So this is pretty cool. I am so lucky that I already know Doug Mader in person, met him in person, hung out with him in person in Key West at his house with his wonderful wife, Jerry, the other brilliant veterinarian in the family. You guys can see the whippet in the background, but that's not as interesting to you as those terrariums in the background. Dr. Doug, we're going to talk about egg binding today, but maybe you should just by pointing introduce the people in the terrariums behind you.
The closest one to me is a little western hognose snake named London. I name all my pets after places I've been. The one next to him is a small Kenyan sand boa that you never see because he lives under the dirt, and his name is Rinka, and that's after the island in Indonesia. And then the one next to that is a small frog named Kevin, who I've never been to a Kevin, but Kevin was one of my very good friends who died suddenly of a stroke, and he is probably the world's leading reptile or amphibian veterinarian. So I
Wow.
got a frog and I named him after Kevin.
That's really nice. Now, I must say, having met the snake who lives under the sand, I am baffled, but those of you watching are not, because you probably have such creatures, by wanting to have a creature that you never see. And you
He
actually
was he
tell
was a
him,
gift.
oh, he was a gift.
Yeah,
What a
he's
great
a
gift.
beautiful snake, but you never see him. He was a gift, and if you sneak in the room at night when it's dark with a red flashlight, he'll be out cruising around. But as soon as he sees you,
Oh,
he dives back down into the sand.
so it's like an ostrich that puts their head in the sand, only he puts his entire self, right?
Yep,
So
sure
this
does.
is would be an interesting gift for those of you that are reptilian lovers. Give somebody a gift they'll never see. Tell them it's in there, and it doesn't even have to be in there. They're like, "This is so great." Only, of
I
course,
know.
eat at the mice. They don't go anywhere. You just gave them all breakfast, so can you just tell us what they had for breakfast? Just because it's so interesting.
I feed all of them, including the frog, eat mice, but I only feed frozen, thawed mice. I just don't believe in feeding live ones. And all reptiles can be trained to eat dead prey, and it's just a really easy way to do it because then you can buy them from a reputable breeder, keep them in your freezer, and then when you need whatever you need, you take it out, you thaw it in some warm water, dry it off. I usually put them in there while they're still warm because the reptiles can sense the warmth. They have thermosensors, and that's what attracts them to the prey item.
And so the idea that you have to keep alive a mouse and then put a mouse in a terrifying situation, maybe for your own amusement, or thinking that's natural environmental enrichment for a snake is not true.
It's true in the sense that, yes, it is natural environmental enrichment for a snake, but I feel bad for the mouse.
Good.
So I don't like to feed live mice. Back in the day, way back when, nobody was selling frozen
That's
mice.
right.
Everybody was selling. You'd have to go to the pet store or you'd have to raise your own mice. And then you'd either put the live mouse in there and you'd watch the live mouse get killed, which I don't really enjoy because I'm a veterinarian and I don't like seeing
Yeah.
animals die. Or every once in a while, you'd put a live mouse or a live rat in the cage and the snake wouldn't be hungry. And then the mouse or the rat would tear the snake apart. So I've seen
I
that
didn't know
happen
that.
many times. Yeah.
Wow. I thought you'd have to take them out, feed them, wind up naming the mouse or the rat, and now you have another pet.
That's
That
actually happened many times with people. A lot of times people bring in a pet mouse. Where'd you get the mouse? I went to go feed it to my snake and he didn't want it, so I decided to keep it. So that's fairly common.
That's funny. So let's talk about snakes breeding and their eggs, which I know nothing about, and even people that have snakes may not know enough about egg binding. I don't know what it means.
There's a term called, it's a lay term called egg binding, and it refers to a snake that produces eggs and tries to go to lay the eggs, but then the eggs don't come out. And we see that in birds as well. We can talk about that on some other show. But there's a couple different actually medical things that we have to talk about. And that is there's something called pre-ovulatory stasis and then post-ovulatory stasis. Pre-ovulatory stasis is when the ovaries, which produce the eggs, develop during the time of year, they're seasonal. And it basically, when the ovaries develop, and they release the follicles, turn into the yolk, which turns into the egg eventually, and they get large. They're the same size as the actual egg. And in some cases, if an animal doesn't have if they're ill for some other reason systemically, let's say they have a bacterial infection, or oftentimes, and probably more commonly, they don't have proper nutrition. And
Ooh,
so in order for an animal to produce eggs, oops, I just had a,
there's a kitty cat,
that's
guys.
my kitty
He's
cat.
got them all. Them all.
So in order for them to produce eggs, they have to have calcium because the eggs are surrounded by calcium. And if
Right.
they're on a suboptimal plane of nutrition, they don't have enough calcium, or it gets much more involved. They don't have enough vitamin D. There's sunshine involved. There's all sorts of things involved. But if they don't have the right nutritional elements and husbandry elements, they can't produce the calcified shell. And if they can't produce that, now you have an egg that's developed that doesn't have a shell on
Wow.
it. That's called pre-ovulatory stasis. Now, the good news and bad news of that is in certain situations, the animal may, if they're nutritionally and physically healthy, they may say, okay, this isn't the right time of year. This is not a good year. And they just resorb all of
Mhm.
the yolk. They just resorb it back into their body and they use it next year.
Okay.
Everything is fine. In other situations, like for instance, an animal that is not nutritionally properly fed, they don't have the nutritional reserve to resorb it, and then they become what's known as, again, it's called egg bound, but it's truly not eggs because eggs generally refer to the
Right.
ones that have the shells on them,
Right.
but they can die. So the challenging part is most animals, as they progress through their gestation, which is means they're making their eggs, as they progress, they stop eating. And that's a normal physiological function. It's called
Okay.
physiological anorexia. And as they get closer and closer to laying their eggs, their appetite wanes and then eventually stops. They lay their eggs and they start eating again. So what typically happens with most people is that they notice that their pet stops eating and then they take it to the veterinarian, and then the veterinarian examines it and says, oh, this animal is egg bound. And that's
Okay.
why it's not
How do you
eating.
how do you examine? You feel the lump in their belly or their
Yeah, an experienced veterinarian should be able to run their fingers down the snake and feel the lumps in the belly. And you can
okay.
feel the eggs, whether they are shelled or not shelled. You
Okay.
can also do an x-ray, which won't hurt the eggs, by the way. And you can also do an ultrasound. So there's a
Okay.
lot of different ways you can figure out whether it has or does not have a shell on it.
Okay.
And if they don't have a shell, again, it's normal for them to not eat. And so oftentimes what I'll do is I'll discuss it with the client, make sure that they have proper housing. In other words, the snake needs to have a substrate. They will lay eggs on newspaper, but that's not ideal. Ideal,
Right.
they should have some kind of a substrate where they can dig a hole or hunker down and make a little nest and lay their eggs. They're not maternal like a crocodile, let's say. Some snakes, like the pythons, will actually make a nest and then incubate their eggs, but they're an extreme exception. Most snakes will just coil up, lay their eggs, and then take off and leave them in a small nest area. So I talked to them about the husbandry, about the heat, about the humidity for that particular species. I discussed what they've been feeding them, make sure they've been feeding the right things. I might want to run a blood test and look at their calcium levels. If their calciums are low, I might put them on a calcium supplement. Oftentimes, these animals, once you adjust the deficiencies, will either go on to produce normal eggs, or as I mentioned earlier, will decide, okay, it's time, it's not the right time this year, and they'll just resorb the ova and then do it again next year. So let's take the next step now, and that is the snake that comes in and you take an x-ray and it's full of shelled eggs. Excuse me. The vast majority of those, even though they have shelled eggs, they may still be calcium deficient because they use up so much calcium to make the shells. They don't have enough calcium left to actually form the contractions that they need to
Wow.
squeeze the eggs out. And
Wow.
so many of these snakes, again, you discuss husbandry, you discuss temperature, humidity, et cetera, et cetera, et cetera. And oftentimes on these snakes, you can give them just a calcium supplement, and many times they'll lay the eggs. Now, some snakes you can actually give oxytocin, which is a hormone. You're
To induce
familiar with it?
labor. Yeah.
Yeah, induces labor, and that will work. It's not as effective in snakes as it is, let's say, in lizards and turtles. In
And human.
lizards and turtles, it works extremely well. Snakes, not so much. But certainly, what I do when I approach these cases is always walk before you run. You get the young docs that go out there that aren't very experienced. Either they may miss it, they don't understand the process, or the first thing they want to do is cut them. Let's take them to surgery and we'll spay it. Spaying a snake is not that easy because the reproductive tract is about a third the length of a snake. So if you've
Wow.
got a 3 foot long snake, your incision is going to be about a foot long.
Oh my
So
God.
it's a big deal.
Yeah.
So you really
The
don't want to
snake
do
is
that if you don't
precious.
have to. There are tricks and keys and things like that that you can get around by making multiple smaller incisions and things, but that's beyond the scope of this chat. So usually what I do is I start out, look at my little kitty cat. He goes, I want to be part
So
of this.
beautiful. Yeah. Kitty cat, wait a minute.
That's Bali, by the way. So Bali is also from Indonesia. So usually what I do is I start out with calcium supplements and I'll try some oxytocin. Sometimes you get lucky and that'll work. If not, then oftentimes what I'll do is I will go ahead and I'll sedate the snake, just give it like a Valium, but not necessarily Valium, but something like that, so that the snake is totally relaxed. They have to be relaxed because if they're fighting you, it's not going to work.
Right.
But if you relax them, you can actually lay them on a flat table. You can just gently feel the eggs,
Wow.
okay? And then what I'll do is, this is after a proper workup, of course. So you do a complete physical examination, always take x-rays, make sure there's nothing blocking it. What if there's a big ureteral stone or
Yeah.
constipation or something?
Right.
You don't want to miss something, so you have to be thorough.
Right. Yeah.
Okay, so assuming everything else is normal, give them a sedative, put them on a warm table with a blanket, and then it can feel the snake, feel the eggs. And oftentimes, interestingly enough, what you can do is just take the snake and you slide him over to the edge of the table so his tail hangs down, her tail hangs
Right.
down, and you can just gently squeeze the eggs
No
and they'll
kidding.
just slide right out, bloop, bloop, and they all fall out. You catch them in a little bucket. And that's actually a very easy way to do it. Sometimes they need a little bit of help. They need a little bit of lubrication. So if that's the case, then under sedation, I'll go up their cloaca, which is their excretory orifice, with a little scope, and I'll inject some sterile lubricant up into the shell gland, which is their uterus. And
Wow.
just pass a little catheter in there, inject some lubricant, massage it a little bit so that the eggs are basically lubricated. And then
Wow.
I gently squeeze the eggs out. And that works in probably 95, 96% of the cases. One of the things I want to bring up is, and you read about it in magazines and on the internet and stuff, is where people will take a needle and they stick a needle through the skin and they suck all the inside of the egg out.
Oh.
And yes, it can work if it's done properly, okay? But A, it's going to hurt. So I don't ever do it unless the animal is sedated properly. I don't do it on an awake animal because they're going to fight you. And also, if you do that, you do risk puncturing the egg and having it break. And
Sure.
now, if the inside of the egg leaks into the inside of the snake, you've got a dead snake. So people do it, people talk about it, people say they've been very successful, and I've seen it being done. I do it, but when I do it under extremely controlled circumstances, so that I make sure I don't have any of the eggs break or I don't have the eggs rupture and leak. So those are the general steps that I do. Now, if I've done all of that and I still can't get the eggs out, then and only then will I take the snake to surgery. And what I do is I don't make one big long incision. I make multiple small incisions, and you can actually slide the reproductive tract forward and back several inches. So if I've got a 3 foot long snake that would need about a 1 foot long incision, instead I may make three 2 inch incisions and then just slide the reproductive tract back and forth and to pop the eggs out. That's the easiest way to do it. Now, a couple things that need to be said. If you've got a really valuable animal and people go, I want to use them as a breeder, there is some thought that if you take them to surgery, there's a chance that you may ruin them from breeding in the future. And that is a possibility. If you get a lot of scar tissue, there's a good chance that it may never be able to lay eggs normally again, and you're going to have to do a C-section again the following year. If you have a snake that is not important as a breeder, then consider actually spaying it like you would a dog or a cat. But now you've got to move that incision up even a little bit further because now you've got to go after the ovaries. And just like the shell gland, the ovaries are pretty long in a snake. So you've got to oftentimes make multiple incisions. So spaying a snake is a fairly intense procedure because The biggest one I've ever done was a python about 10 feet. And I think I had probably a total of about 3 feet of incisions on the side of this snake because it was such a long snake.
Was it
So
a privately owned or a zoo owned animal?
that was a privately owned animal. So again, whenever you get one of these animals in that are egg bound, you always want to do the walk before you run approach. Start with the
Right.
basics, check the nutrition, check the husbandry, check the calcium status, slowly work your way up through the different steps. And people need to understand that when they take it to the veterinarian, if the veterinarian is recommending going stepwise and not just jumping right into surgery, they're doing it for the health and safety of your snake. And also, it's a lot cheaper to give an injection of calcium than it is to take it in for surgery. And you don't want to take a snake to surgery if you don't need to, if you can do something simple to correct the problem. Again, so you want to try and find a veterinarian who is experienced with this and actually knows and has done it before. Probably don't go to a vet that's never spayed a snake and ask them to spay your snake. It would be better to go to somebody who's got
Yeah,
experience
that
doing
makes
it.
sense. Yeah, don't anybody come to me and ask me to spay their snake. It would be about the same as a fresh veterinarian who their specialty is large animals or something. And the inside of a snake is something that Dr. Doug Mader and his cohorts who've written the textbooks, taught from the textbooks, and had many years of experience in the field. Make it clear that this is not a home project, guys.
Right.
Snake stops eating, go to the vet. Let the vet do step by step, walk through what might be wrong, and then get your snake well again. And then you'll have lots of little baby snakes. And I don't know, breeding snakes. We should really do a whole episode on having a snake as a breeder. It's like people with pet dogs. Should you breed your dog or your cat? And if so, what is the cost in doing that? And then the management of the sales or the giveaway. Is it like after nobody wanted to buy it, do you just try to give away the leftovers? Breeding for yourself is, I think, a tricky business, something probably left to the professionals. Thank you so much, Dr. Doug, as always, for
Thanks, Tracy.
and say hi and bye to all the little critters that are having breakfast at your house today. Take
All right. You
bye bye.
too. Bye bye.